Thank you for having your pet spayed or neutered. You've become part of the solution to the animal overpopulation problem. You're taking your pet home, and there's some very important post-operative instructions you need to follow. We'll go over these now, but you'll also have a printed copy with your paperwork. So pay attention, there will be a test. If there are any questions or concerns directly related to the surgery during the recovery period, including incision issues, please call the office where the surgery was performed. And make sure you follow these instructions to ensure proper healing. No running, jumping, playing, swimming, or other strenuous activity for 7 to 10 days after surgery. No baths for Fluffy for 2 weeks. And keep your pet calm and quiet. Pets must be kept indoors where they can stay clean, dry, and warm. Dogs must be leash walked, and cats kept indoors. If you have a feral or barn cat, try to keep them in an enclosed environment such as a barn or a garage for a few days before letting them back outside. Check the incision site twice a day. Some bruising is expected, but redness and swelling should be minimal. If you have a male dog, your dog received a scrotal castration. Basically, we unzipped his change purse, took out the money, and didn't zip it back up. The incision has been made directly into the scrotum, and there is one suture in the scrotum deep in the tissue layers. There are no skin sutures. This means that there may be a slight gapping of the skin edges, and you may see pink tissue. This is normal. The skin is left open specifically to allow the incision to drain. This prevents the scrotum from filling with fluid and causing pain and swelling. There will be a small amount of discharge from the incision. It should be clear, straw-colored fluid, possibly with a pink tinge. There should be no obvious blood, and there should not be any tissue protruding from the incision site. If you notice any foul-smelling discharge, bright red discharge, swelling, or pain, please call our office. This is important. Do not allow your pet to lick or chew at the incision. If they do, an e-collar must be used for your dog. You can buy one now for $8 if you know your pet's a licker. If you have a cat, you can purchase a bottle of Bitter Orange, a licking deterrent from the front desk. This is for their benefit. They may look pitiful, but they'll appreciate not having to come back to Mountain View to get a swollen incision checked out. Your pet received internal sutures. These will dissolve in about 3 months, so there's no need to bring them back to have them removed. Warning: graphic images. Turn your head if you don't want to see it. These are not normally healing surgical sites. If your pet's incision looks like this, call us immediately. Okay, gooey grossness is over. Back to your regularly scheduled post-op instructions. Appetite should return gradually within 24 hours of surgery. Do not change your pet's diet at this time, and don't give them junk food, table scraps, milk, or any other people food during the recovery period, because this could mask post-surgical complications. Don't change their diet. Don't go to McDonald's and get Spot Big Mac as a treat for being a good boy at the doctor. Dogs may have a slight cough for a few days after surgery from the breathing tube. Be on the lookout for these symptoms post-surgery: lethargy or depression lasting for more than 24 hours, pale gums, diarrhea or vomiting, discharge or bleeding from the incisions, difficulty urinating, or labored breathing. If you observe any of these signs, please call the clinic where the surgery was performed during business hours or our pager number 540-250-3558 after hours and on weekends. Your pet received a tattoo near their incision. No, it doesn't say mom. It's a little green line on their belly. This is a common practice to identify sterilized animals. The tattoo is a scoring process in the skin. It's not an extra incision. Glue was used to seal the tattoo. Don't rub it, scrub it, or wet it. It'll flake off on its own. If an initial vaccine was given to your pet, a booster vaccine is needed in 3 to 4 weeks in order to provide effective protection from diseases. Talk to your full-service vet about a vaccine schedule. Your dog will have pain medication to take home. The ladies at the front desk will explain the proper dosing. Your cat received a pain medication injection, so you don't have to try to give them a pill, because that's as hard as trying to give a cat a pill. All follow-up concerns must be screened through our veterinary staff. Mountain View Humane will not be responsible for the cost of care at another veterinary facility. If you have an urgent question after hours, including those pertaining to incision issues, please call the emergency line 540-250-3558 and leave us a message. One of our vet techs will call you back as soon as possible. Mountain View Humane will treat at our clinic, at minimal cost, any post-op complications resulting directly from surgery if the above post-op instructions are followed in full. Your regular veterinarian must address illness or injuries that are not a direct result of surgery. Please call our office as soon as you see cause for concern. We can't be held responsible for complications resulting from failure to follow post-op instructions or for contagious diseases for which the animal was not properly vaccinated. A number of local veterinarians veterinary clinics have agreed to offer free incision rechecks for our patients 1 week after their surgery. We highly recommend you visit the clinic of your choice in order to form a relationship with a local vet clinic and learn all about their other recommended preventive care needs for your pet. You must call to set up an appointment with your clinic of choice prior to arriving at the clinic. But if you've kept an eye on your pet's incision during the healing process, a recheck shouldn't be needed. And before you leave, have you picked up your doses of Frontline Flea and Tick Preventive yet? We have a special going on. Buy 3, get 1 free. Ask one of the lovely ladies at the front desk for your pet's doses today.